Osteoporosis is a silent disease. It creeps into people's lives so quietly that we often don't even notice it until the damage is irreversible. This condition, which gradually weakens bones, can be present in our bodies without giving any visible signs until it's too late. Sometimes, back pain or a feeling of fatigue when carrying out daily activities can be mistaken for simple consequences of aging or natural wear and tear. However, when these symptoms are ignored, you may be dealing with something much more serious, osteoporosis. The big issue is that osteoporosis doesn't scream for attention. It hides silently, causing many people to underestimate the severity of the first signs. A pain here, a difficulty moving there, and the years go by without seeking help. When osteoporosis becomes a serious problem, the bones are so weakened that a simple movement, such as bending over to pick something up from the floor or even a slight fall, can result in painful fractures. And what many people don't know is that these fractures can easily occur long before the disease is even noticed. The impact of the silence of osteoporosis is devastating because people ignore the initial signs, believing that it is all part of the natural aging process. These early signs can be subtle, but they shouldn't be ignored. When you start to experience constant back pain that doesn't get better over time, or notice that your bones are more fragile than they used to be, your body is trying to warn you. You may not have any obvious fractures, but small internal breaks may already be occurring without you even realizing it. Osteoporosis is often called the silent disease because it doesn't show any obvious symptoms until the damage is significant. However, that doesn't mean there aren't any warning signs. The problem is that people often ignore these signs due to their busy schedules or lack of knowledge about osteoporosis. For example, if you experience back pain or difficulty performing simple tasks like carrying groceries or getting up from a chair, you may think it's just a temporary discomfort. But these are signs that shouldn't be ignored. Osteoporosis could be behind all of this, affecting the structure of your bones without you even realizing it. The condition gradually weakens bone density, making your bones more susceptible to injury and fractures, often before you even feel pain. Therefore, it is essential to pay attention to your body and those small interruptions in your routine. They may be more than just fatigue or temporary discomfort. What may be happening is that osteoporosis is silently setting in, and your body is asking for help. Do not ignore these signs. Often, early diagnosis can make all the difference in preventing serious complications. When you realize that you are ignoring obvious signs that something is wrong, it is time to act. After all, the impact of the silence of osteoporosis is real and devastating, but you have the power to change this story if you act now. Many people are unaware of the early signs of osteoporosis, or even ignore them due to lack of information or the natural tendency to attribute symptoms to other causes. However, recognizing these signs is essential to prevent further damage. Osteoporosis is a progressive disease, which means that its symptoms can worsen over time, making treatment more difficult and complications more serious. The key is to identify the first signs and symptoms as soon as possible to seek medical advice and avoid irreversible damage. One of the first symptoms of osteoporosis can be back pain, which may be mild at first, but can get worse over time. This pain is not just muscle discomfort. It can be the result of small fractures in the vertebrae, caused by weakened bones. People often associate this pain with poor posture or fatigue from everyday life, but this is a dangerous mistake. When the bones begin to lose density, back pain can become a clear sign of developing osteoporosis. If the pain is persistent and does not improve with rest, it is time to investigate further what may be causing this symptom. Another common but often overlooked sign is height loss. As osteoporosis progresses, the vertebrae in the spine can become compressed, resulting in a noticeable decrease in a person's height. This occurs because the bones become so fragile that they crush or deform, affecting posture and height. Gradual height loss can be a clear sign that your bones are losing density, especially if you notice that your height has decreased significantly over the years. If you notice that your shoes no longer fit the same or that your posture has changed, it is important to consider osteoporosis as a possibility. Additionally, osteoporosis can begin to manifest itself in subtle but dangerous ways, such as more frequent fractures. If you start to notice that you are bruising more easily than before, or that small fractures are occurring for no apparent reason, this is a clear sign that your bones are not as strong as they should be. Breaks in areas such as the wrist, hip, and spine, which usually occur after falls or moderate impacts, are an indication that osteoporosis may be at work. The bone weakness caused by this condition makes bones break much more easily, often without a significant cause. In some cases, the early signs of osteoporosis can be so subtle that they go unnoticed for years. You may start to feel a slight loss of strength in your hands or have difficulty lifting heavy objects without realizing that this is a sign of weaker bones. Osteoporosis is not limited to obvious fractures. It affects the body in ways that may seem simple and harmless, but over time can lead to very serious complications. Pain, muscle weakness, and difficulty performing tasks that were once simple are all warning signs that should not be ignored. Now more than ever, it's important to understand that osteoporosis can develop without obvious warnings. As we age, our bone density naturally decreases, but that doesn't mean we should accept this condition as part of aging. Identifying early signs is the first step in preventing osteoporosis from becoming a larger, more difficult to treat health problem. Early detection of the disease through specific tests can be the key to preventing serious damage, such as bone fractures, which directly affect quality of life. Don't wait for the signs to get worse and start paying attention to your body now. Understanding what leads to the development of osteoporosis is essential for those seeking to prevent the disease or effectively control it. Osteoporosis does not occur by chance. There are several factors that contribute to the weakening of bones, and many of them are within our daily choices. It is important to understand that although genetics play a crucial role, lifestyle habits, diet, and even health conditions can accelerate or slow down the process of bone weakening. The main risk factor for osteoporosis is old age, and this affects both men and women. As we age, our bodies go through a series of hormonal and metabolic changes that directly affect bone health. For women, menopause, this is one of the most critical times, as the reduction in estrogen levels the hormone responsible for helping to maintain bone density, accelerates the loss of bone mass. During this period, many women begin to notice a sharp decline in the health of their bones, which can increase the likelihood of developing osteoporosis. Another important factor is related to calcium and vitamin D deficiency, two essential nutrients for bone health. Calcium is essential for the formation and maintenance of bones, while vitamin D helps in the absorption of this calcium. The lack of a balanced diet with adequate intake of these nutrients can accelerate the process of bone weakening, making bones more fragile and prone to fractures. In addition, insufficient exposure to the sun, which is one of the primary sources of vitamin D, can also be an aggravating factor, especially in people who live in places with little sunlight or who have a predominantly indoor lifestyle. The sedentary lifestyle is another villain that contributes significantly to osteoporosis. Physical exercise, especially weight-bearing and resistance activities, plays a fundamental role in maintaining bone density. When bones are subjected to the stress generated by exercise, they tend to strengthen to adapt. On the other hand, lack of physical activity causes bones to become more fragile and, over time, more susceptible to diseases such as osteoporosis. Regular exercise, therefore, is one of the most effective forms of prevention, helping to keep bones strong and resilient. Furthermore, habits such as smoking and excessive alcohol consumption are also directly linked to the development of osteoporosis. Smoking reduces the body's ability to absorb calcium and negatively affects bone formation. Similarly, excessive alcohol consumption interferes with bone metabolism, making them more vulnerable. Smoking, for example, is known to decrease estrogen levels in women, which can accelerate bone loss. Alcohol, in turn, impairs the bone mineralization process, weakening bones over time. Genetic factors are also extremely important. If you have a family history of osteoporosis, you are more likely to develop the disease. This is because genetics influence bone density and the body's ability to retain the minerals needed to maintain healthy bones. However, while genetic factors cannot be changed, many environmental factors, such as diet, physical activity, and other habits, can be controlled to minimize the risk. Furthermore, certain health conditions and medications can increase the risk of osteoporosis. Diseases such as rheumatoid arthritis, type 1 diabetes, hyperthyroidism, and chronic bowel disease can affect calcium absorption and bone health. Medications such as corticosteroids used to treat inflammation and other conditions can also accelerate bone loss. Therefore, it is important that patients taking these medications have regular medical checkups to monitor their bone health. In short, osteoporosis is the result of a complex combination of factors, many of which can be prevented or controlled. Understanding its causes is essential for making informed decisions about your health. Preventing osteoporosis requires adopting healthy habits, such as a balanced diet rich in calcium and vitamin D, exercising regularly, avoiding smoking and excessive alcohol consumption, and undergoing regular checkups if you have a family history of the condition or are in a risk group. Taking care of your bone health is an ongoing effort, but with the right choices, it is possible to prevent the disease and ensure a healthier, more active life. Ignoring the signs of osteoporosis may seem harmless at first, but the consequences of not treating this disease can be extremely serious and in many cases irreversible. Osteoporosis is not just a matter of weak bones. Left untreated, it can turn an active person's life into a routine marked by chronic pain, dependence, and significant loss of quality of life. What starts as a mild pain or a simple fracture can evolve into a devastating scenario. One of the main consequences of untreated osteoporosis is recurrent fractures, especially in the spine, hips, and wrists. Fractures in the spine, for example, can occur even without a fall. All it takes is a strong sneeze or lifting a light object incorrectly. These fractures, called compression fractures, cause intense pain and can lead to postural deformities, such as the famous dowager's hump, in addition to decreasing height over time. And it's not just the aesthetics that change. Constant pain and limited movement directly affect the patient's physical and emotional well-being. Hip fractures, in particular, represent one of the most serious consequences. This type of injury, common among elderly people with osteoporosis, often requires surgery and long recovery periods. In many cases, the person never fully recovers the mobility they had before. This can lead to dependence on canes, walkers, or even wheelchairs. What's more, about 20 to 30% of elderly patients who suffer a hip fracture die within a year of the trauma, not only because of the fracture itself, but because of associated complications, such as infections, thrombosis, loss of autonomy, and depression. Another profound impact is on quality of life. Constant pain, limited movement, and the fear of suffering a new fracture cause many patients to avoid daily activities. Simple tasks such as climbing stairs, picking something up from the floor, or even leaving the house become a risk. This directly affects social interaction and can trigger symptoms of anxiety and depression. The patient no longer lives with freedom and begins to live in fear. This isolation, combined with pain and limitations, contributes to faster aging and a significant loss of self-esteem. In addition to physical and emotional issues, osteoporosis also brings financial impacts. Fracture treatment, surgeries, rehabilitation, ongoing medication, and specialist monitoring generate high costs for the patient, the family, and the health system. In many cases, it is necessary to adapt the home with grab bars, shower chairs, and other equipment to ensure the patient's safety, which may not be within everyone's reach. Therefore, preventing and treating osteoporosis early is not only a health issue, but also a smart and economical decision. Neglecting osteoporosis is like turning a blind eye to a problem that can profoundly change your routine. And the most tragic thing is that most of these consequences could be avoided with early diagnosis, changes in habits, and appropriate treatment. The truth is simple and hard. If you don't treat osteoporosis now, it will limit your life in the future. And when that happens, you may wish you had paid more attention to the signs. The good news is that osteoporosis, although a serious condition, is preventable and treatable, especially if diagnosed in its early stages. The lifestyle choices you make today have a significant impact on the health of your bones in the future. Prevention is undoubtedly the key to avoiding the devastating consequences of this silent disease. And best of all, prevention starts now with small daily changes that can ensure strong bones for a lifetime. A food plays a key role in preventing osteoporosis. The intake of calcium, potassium, vitamin D is essential for keeping bones healthy and strong. Calcium is the main mineral that makes up our bones, and vitamin D is crucial for the absorption of this mineral. Foods rich in calcium, such as milk, cheese, yogurt, dark leafy vegetables, and sardines, should be included in the diet. Vitamin D can be obtained through sun exposure and foods such as fatty fish, salmon, tuna, and eggs. In many cases, especially for people who have difficulty consuming foods rich in these nutrients, supplements may be recommended by a doctor, always with proper guidance. Furthermore, the physical exercise, regular exercise, is one of the pillars of bone health. Exercise strengthens bones and improves bone density, helping to prevent osteoporosis. Activities such as walking, running, dancing, and weight training are extremely beneficial as they put pressure on the bones, stimulating their mineralization and strengthening. Resistance exercises, which involve lifting weights, are especially effective in building bone mass. But be careful. Impact exercises are also important for stimulating bones, so activities such as jumping rope or running help to keep bones strong. Keep a healthy weight is also essential. Being overweight and obese can increase the risk of osteoporosis, as excess weight puts a strain on bones and joints, damaging their health over time. At the same time, excessive weight loss, especially through strict diets, can have the opposite effect, compromising bone density. A balance between food intake and physical activity is essential to maintaining healthy bones, preventing the accumulation of fat or loss of bone mass. Another important factor in preventing osteoporosis is smoking cessation and moderate alcohol consumption. Smoking is one of the main factors that contribute to the loss of bone density. Smoking reduces calcium absorption and interferes with the bone regeneration process, accelerating osteoporosis. Excessive alcohol consumption interferes with bone formation in addition to increasing the risk of falls and fractures. Quitting smoking and limiting alcohol intake are simple but extremely effective measures in preventing bone problems. In addition to daily habits, medical monitoring also plays a crucial role in preventing osteoporosis. Regular bone density tests can identify bone loss early, allowing interventions and treatments to be made before the problem worsens. The main diagnostic tool is bone densiometry, which is a simple and quick test that measures bone density and helps identify osteoporosis in its early stages. If you have a family history of osteoporosis or are in a risk group, it is important to discuss with your doctor the need for this test regularly. Finally, manage stress. It can also be an indirect form of prevention. Chronic stress can increase the production of cortisol, a hormone that in excess can contribute to bone mass loss. Practices such as meditation, yoga, and deep breathing exercises can help control stress levels and, consequently, protect bone health. Preventing osteoporosis is a simple task, but it requires discipline and dedication. By adopting healthy eating habits, exercising, and taking care of your body, you are not only preventing osteoporosis, but also ensuring a more active, healthy life without limitations. And remember, It's never too late to start. The sooner you act, the stronger and healthier your bones will be in the future. Early diagnosis of osteoporosis is crucial to prevent serious complications and to implement effective treatment. Because osteoporosis is a silent disease, it often does not present symptoms until the damage to the bones is significant. Therefore, it is essential that people are aware of the diagnosis methods and undergo regular screenings, especially those who are at risk due to factors such as advanced age, family history, or pre-existing health conditions. The main test used to diagnose osteoporosis is bone densitometry, also known as DEXA, dual energy X-ray absorptiometry. This test is painless, quick, and non-invasive. It uses low-intensity X-rays to measure bone density, that is, the amount of minerals such as calcium in the bones. From the results of the densitometry, doctors can determine the degree of bone loss and the risk of fractures. The reference values are used to classify the patient's bone health based on the Socalite index, which compares the patient's bone density with that of a healthy young person. Bone densitometry is recommended for women over 65 and men over 70. However, postmenopausal women or people with risk factors, such as a family history of osteoporosis, smoking, prolonged use of medications such as corticosteroids, among others, should consider having the exam sooner as recommended by their doctor. The same applies to men with risk factors. Having the exam periodically allows changes in bone density to be detected over time, enabling early interventions. In addition to bone densitometry, some doctors may also suggest blood tests to assess the level of calcium and vitamin D, which are essential for bone health. A deficiency in these nutrients can be an indication of a risk for developing osteoporosis. Another test that may be requested is the urine test, which measures the levels of calcium excreted, which can help identify possible problems with the absorption and retention of calcium by the body. Another important aspect of diagnosis is to identify clinical signs and patient history that may suggest osteoporosis. For example, patients with frequent fractures, back pain that does not improve, loss of height, or changes in posture may be referred for specific tests. The doctor will also consider risk factors such as a family history of osteoporosis, chronic diseases, long-term use of medications that affect bone health, and lifestyle habits such as a sedentary lifestyle or smoking. After performing the tests, the doctor can classify the severity of osteoporosis based on the results of the bone densitometry and decide on the most appropriate treatment. If the diagnosis is confirmed, treatment may include changes in diet and lifestyle, as well as the use of specific medications to strengthen the bones and reduce the risk of fractures. It is important to note that although osteoporosis does not present visible symptoms in its early stages, early diagnosis can make a vital difference in preventing serious fractures. Therefore, the best way to know if you have osteoporosis is to undergo regular checkups and maintain medical follow-up, especially if you fall into one of the risk groups. Do not wait for serious signs to seek help. Prevention is the best way to keep your bones strong and healthy throughout your life. Osteoporosis is a condition that can be managed and often prevented with the right approach. Ignoring your body's signals or Putting off regular checkups can result in serious complications, such as fractures, loss of mobility, and a drastic decrease in quality of life. The impact of osteoporosis is not limited to just physical health. It can also affect emotional, social, and even financial well-being, making it essential for everyone to be aware of the risks and take preventative measures to protect their bones. Good news is that you have the power to prevent osteoporosis, and, if it is already in its early stages, it can be treated effectively. This starts with simple actions, such as a balanced diet rich in calcium and vitamin D, regular exercise, and adopting healthy habits. In addition, early diagnosis through tests such as bone densitometry allows you to always be one step ahead of the disease, making treatment more effective and avoiding serious complications. The most important thing is that you do not ignore your body's signals. Back pain, frequent fractures, loss of height, or changes in posture may be the first signs that osteoporosis is setting in. Seeking medical help and undergoing the necessary tests is essential to prevent the progression of the disease and avoid the devastating consequences of weakened bones. The sooner you act, the greater your chances of preserving your bone health and living a better quality of life. Don't wait until it's too late. Bone health care should start early, but it's never too late to take preventative measures. Protect your bones, invest in your health, and live more freely, without the limitations imposed by osteoporosis. Your quality of life is in your hands, and the time to act is now. If you have noticed any of these signs, or if you are at risk, see a doctor and get the necessary tests. Don't put off until tomorrow what can be prevented today.